Hi, my name is Naomi Lopez, and I'm Director of Healthcare Policy at the Goldwater Institute. Thank you for your interest in the Goldwater Institute's continuing and dedicated coverage of the coronavirus crisis. Over the weekend, the U.S. Food and Drug Administration issued an emergency authorization for the release of chloroquine and hydroxychloroquine from the nation's stockpile. This is a very important development because as pharmaceutical companies donate millions to tens of millions of doses of these treatments to the nation's stockpile, the federal agencies will be distributing these treatments to public health agencies around the country. There is no FDA-approved treatment for the COVID-19 virus. There are treatments in the investigational pipeline, but it could be months or years before they obtain the FDA's final green light. Chloroquine and hydroxychloroquine are FDA approved for malaria, lupus, and rheumatoid arthritis. There are reasons to believe that it might be helpful to some patients who are facing this devastating virus. There have been some small clinical trials conducted around the world, and reports from frontline health workers also indicate that it might be effective. In fact, this treatment is currently being used in hospital settings around the country. The importance of this release from the national stockpile means that physicians in hospital settings around the country will have another tool in their arsenal to help treat those patients who are in the hospital but who don't qualify for a clinical trial or are unable to participate in one. This is a really important step in getting the right treatment to the right patient at the right time, and the FDA should be lauded for this decision. Thank you again for your interest in the Goldwater Institute's dedicated coverage of this virus, and thank you so much for your support.